My name is Dr. Adel El Ansary. I am a professor of critical care and anesthesiology in Faculty of Medicine at Ain Shams University. I work as the head of the cardiac intensive care in my institution. It's really my passion to care for all critically ill patients, including those after cardiac surgery, after transplant surgery, patients with respiratory failure, with liver or kidney failure. Those are the main patients that we have. One of the big issues that any intensivist or any ICU unit has is the management of sepsis. Patients with sepsis are affected and they have increased mortality rates. We encounter those either in the perioperative period or again after organ dysfunction or failure. It is very well known that each and every hour after the diagnosis of sepsis increases the mortality by 7 to 8% if we cannot really choose the proper antimicrobial. So the diagnosis, first, how can we alert all our team or our physicians that this patient or he or she might have sepsis as a diagnosis? This is really important, and we actually utilize the clinical scoring systems in that, not only the QSOFA, but also we use other alerting scoring systems clinically. But most importantly, we need to find out, to diagnose the cause of the sepsis, the causative organism, and if we can know also the resistance mechanism. This is really important because at our institution we are a tertiary center, so at least 50% of our patients are coming from other hospitals, and these patients are very well known to harbor multi-drug resistant organisms. So for us, it was a journey of improvement. First, we had nothing except the traditional cultures, using blood culture, sputum culture, urine culture, and so on. And 4 or 5 years ago, we started to use molecular biology as a diagnostic parameter, which is really important because it provides several things. First, it provides rapidity. It actually gets us the results in a much more concise period of time, which is really important. Again, it does not only diagnose sepsis or the causative organism, but also it diagnoses the resistance mechanism. And this allows us to choose much more accurately the proper antimicrobial, which is again the most important factor in the outcome generation. So these new techniques utilizing the DNA or the PCR technology are really important to have as an adjunct to other investigations, including detecting the function of the bodies, the chemistry of the kidney, the liver, and so on, the hemodynamics. These are all integrated in the management of any patients with sepsis or septic shock. One of the factors that evaluates any big hospital or institution is the rate of antimicrobial resistance. When we used the molecular biology diagnostics, this allowed us to decrease the exposure of our patients to multitude of antimicrobials and to decrease the duration. Both steps, either to decrease the spectrum of antimicrobials given and to decrease the duration, are the main CDC actually supported and WHO supported techniques to mitigate or to combat antimicrobial resistance. So what we have seen in the last 3-4 years is that we have now reduced antimicrobial resistance through accurate diagnosis of the cause, which improves the outcome, but also reduces the resistance through reduction of the duration of therapy and reduction of the spectrum of therapy. Rather than giving 3 or 4 antimicrobials to combat whatever we think is the cause, now we have one cause or 2 causes that can be treated with 2 drugs alone and for a shorter period of time. Both will lead always to reduction of antimicrobial resistance, which is a real important target in our institution. The use of rapid diagnostics is really important in several arenas. One of them is the management of severe hospital-acquired pneumonia or ventilator-associated pneumonia, both of which we see more and more in our hospital, because we have patients with multi-organ dysfunction that are dependent on life support machines like the ventilator or the ECMO or other machines, pacemaker. All of these gadgets lead actually to increased risk of pneumonia, especially with the rising age. So using the molecular diagnostics in pneumonia cases will lead to accurate diagnosis and then accurate treatment, because no organism is a sole factor in leading to pneumonia, or pneumonia is caused by every organism there ever, either viral, bacterial, or fungal. All of them can lead to pneumonia. That's why the accurate diagnosis is never dependent on empirical factors. It must be diagnosed by identification of the organism itself. That's why in pneumonia especially, it is really important to know the causative organism, which is much easier and much quicker identified using molecular biological techniques. Using molecular diagnostics is associated with clear benefits. The most important of them is the accurate diagnosis that is rapid enough. So we are talking about 2-4 hours of detecting the causative organism, and this is another merit, is detecting the genetic resistance mechanism. It is clearly important to know that these things are not absolute. It detects what is in the panel. If there is an organism that is not a part of the panel, it will not detect it. It will not say to the doctor, is it there or not there? Because it's not in the panel itself. So this is one caveat that we have to make sure as clinicians that we are sure that the probable organisms are there in the selected panel. This is one. Another thing is that the PCR technology is so powerful that it sometimes detects contamination in the sample. If the sample is taken without carefulness, it might be contaminated with an organism that is not in the patient. It's actually during the transport is there in the sample itself, not in the patient. And another thing is that because it is a very powerful technology, it sometimes detects genes while the patient is actually recovering. So the patient is treated or self-treated or now immune for this genetic mechanism, but it will be detected. That's why we always tell our younger physicians to always check clinically on the patient. It's really important. Does he have infection or not clinically? This is really important. And also to utilize the traditional culture methods together with the molecular biology results, not alone. Sepsis is a real worldwide problem. Managing sepsis without diagnosing the cause is shooting in the dark. We have to know the etiological diagnosis, which is provided by the new molecular methods which are not only leads to the diagnosis of the cause, but also a diagnosis of the genetic mechanism and the resistance mechanism, both of which are really important armamentarium to any physician treating sepsis.